9:18 right now. It's another topic that's happening to a lot of women, especially those over 50 or those who have gone through cancer treatments, and women who have been menopausal or that are menopausal right now. So joining us right now in the Fox 32 studios to keep this conversation going is Dr. Kenneth Finkelstein with the Women's Healthcare of Illinois, and he does a lot of work out at Christ Hospital. And of course, one of his patients, Susan Schreffler. Susan Schreffler is here. Let's talk about this, doctor. Thanks for being with us, everybody. But let's talk about this, something women don't want to talk about, and that's vaginal dryness and how it's created by menopause or going through breast cancer treatment.
Yeah, absolutely. Thanks for having me back again, and you look wonderful.
Thank you.
So this is a big issue that women simply don't like to talk about. When you go through menopause, what's happening is that the changes that go through your body, when you pretty much run out of eggs, lose the ability to reproduce, your body starts making changes. And one of the changes that happens is blood flow moves away from the vagina area. This causes the glands to stop, the lubrication to stop, the sensitivity to go away, and the vagina to get very thin. And this causes a lot of pain, dryness, discomfort, total changes in, the sex life in a man and a woman at this age. And for breast cancer patients, it's specifically really terrible, because most of the time when you're having treatment for breast cancer, you're given medication specifically to be anti-estrogen, which makes the problem worse. So not only the trauma of cancer, the trauma of possibly breast removal, but now you've lost relations with your husband.
And so many times women identify themselves with their breasts, with our yah-yah there, that, we feel like that's what gives us that, that intimacy makes us feel more like women. And when you lose some of that, let's talk to you, Susan, bring you in on the conversation. You were premenopausal, you say, and you noticed a change.
Actually, I had surgery, and so I immediately went into menopause in my early 30s.
Early 30s
yes.
for that. That's dramatic right there. You didn't know what was going on because your girlfriends at that time, you start talking about it in your 40s, but they're in their 30s too.
Right, yeah.
So go ahead.
My symptoms were pretty extreme, I thought, and thought I had to just live with it. And then I learned about vaginal restoration, and I Googled and found Doctor. It was great.
You found Dr. K here, Special K. So did you talk to your friends about it, or did you just hit the internet and then said, let me seek professional assistance on this one?
To the internet, professional assistance, went in to see doctor, had my first treatment that day. And after, it's a series of 3, and after the 3rd one, I can tell you I am back to normal. No pain.
Look at that smile on her face.
My husband's very happy.
Okay, let's talk about that then. You've got a new procedure that you do in the office called the Mona Lisa Touch, and it's changing lives.
Yeah, absolutely. So I like to refer to it as a vaginal restoration. It's about bringing the vagina back, restoring it back to where it was before menopause. And it's about the woman. It's about her sexuality, her sex life. So it's a completely painless procedure. It's a probe that goes in the vagina. Takes about 5 to 7 minutes. Very low intensity CO2 laser that actually stimulates blood flow to come back to the vagina, which I said earlier was missing.
Right.
Once the blood flow comes back, the glands reactivate, the lubrication comes back, the collagen comes back, it retains water, the softness comes back, the sensitivity is better. So basically it's about bringing the vagina back. So we do 3 treatments, 6 weeks apart, completely painless, no downtime, no anesthesia. I mean, and for a breast cancer patient, it has literally been a miracle because they can use no hormones, and there's been nothing to fix that until now.
So they start to feel like Stella and get in their groove.
Yes, they do.
Doctor, if people want more information about this, where can they go? What's your web address?
Yeah, so WHCIllinois.com, and just get on, Google me again. That's what we decided last time.
Google
and give us a call. We have a couple locations. I'd love to help a lot of people.
And thank you so much. You did a great job. He was the one that did my hysterectomy, and I'm back. I'm bouncing back, okay? All right, it is time. Susan, thank you for joining us. 9:22. Right now it's time for us to take a break. We will be right back with more Good Day Chicago.